about an update on COVID-19 and what's going on with that. As most of you know, the state of Missouri today has lifted the stay-at-home order in most areas of the state. St. Louis, Kansas City, Springfield, and Columbia have not lifted the stay-at-home order at this point because these locations have a lot more incidence of the virus than in other areas of the state. There are actually counties in the state that only have a couple of cases of COVID-19. So it makes sense for us to have a different approach here in the St. Louis region than it does in some of those other counties. So that began today in the rest of the state of Missouri. There still are restrictions, even with the state lifting the order having to do with social distancing primarily. But here in St. Louis, we have not lifted the stay-at-home order. Over the weekend, we had Saturday and Sunday, we had 154 new cases in the city of St. Louis. That brings our total number of cases in the city to 1,345 with 70 deaths. Confirmed cases in St. Louis County to 3,521. So the combination of those two numbers is right at 5,000 cases. And that compares with about 8,300 cases in the entire state. So as you can see, we continue to have the majority of the cases right here in the St. Louis region, about 2/3 of the cases when you include St. Charles, which has 612 cases. So we continue to have community spread. We do believe that we have hit the peak. We're heading down the other side of that curve. Not very rapidly, I might add, but we are heading down the other side of that curve. I'm looking to see if I got some new numbers here. Yes, I did. So there are today 653 hospitalizations in the region. That's down from 660 yesterday, so down 7. ICU patients are steady, but up a little bit, up 164 today. There were 158 yesterday. People on ventilators are about even with about 110 today. So looking at that day to day, we have to consider a moving average. It is a little bit better day to day in most of these stats, but still a very serious situation. So that is those are the numbers right now for COVID-19. I ask for your patience, and I know it's hard, and I know your patience is wearing thin. I understand that. My own patience is wearing thin, but we've got to be firm here and continue the stay-at-home order for a while longer. We really think mid-May, fingers crossed, mid-May, if we can continue to see some improved numbers, that we will be able to gradually reopen our economy to some extent. We're working very hard right now on what that's going to look like, and we expect to have something for you this week, by the end of this week, that St. Louis City and County think might be a viable way to get started. Now, some people would say, why are the number of cases going up a bit, or why across the state this actually happened? There's a little bit more testing going on as we continue to get a few more tests each time. And so these cases were probably always out there in the population, but we didn't know because we didn't have enough tests to figure that out. Today, as we test a little more each day, we are getting more cases. So it is a little bit of it is just the statistics of it all. When you test more, you're going to find more cases, but that doesn't mean those cases weren't there all along. So thank you for sticking with us here, staying at home. For those of you working, thank you for continuing to work. Police officers, firefighters, EMS, dispatchers, people who work in our water department, people working in the hospitals, doctors, nurses, people working housekeeping, dietary, x-ray, all the departments of the hospital. Thank you. And thank you also to the grocery store workers who we know have been working hard. I was at the grocery store yesterday. It was fairly busy. I observed a couple of things. One, some people, the grocery store, the folks checking you out, working at the grocery store, were all wearing masks. That's good. I would say more than half of the people in the grocery store when I was there were wearing masks. That's good. But we really are strongly recommending that everybody wear a mask when they go out in public, when it is unpredictable as to whether or not you're going to be able to socially distance. And I think that's certainly true at the grocery store. It's a little unpredictable as to whether or not you're going to be within 6 feet of someone. So please, masks. I've got mine right here. I'm wearing it. I wear it at the office because there are other folks around, and I just want to make sure that they're protected from me and I'm protected from them. So please wear masks when you go out, go to the grocery store, drugstore, the places that you need to go. Second item, some of you may have read this in the paper or seen it on the news. There were 2 fairly major encampments, tent encampments of homeless people that were downtown. I want to give a thank you to the volunteer outreach workers who have who work year-round with the homeless population in conjunction with some of the folks on the continuum of care and our own human services department. You all were a major plus for us this weekend in being able to get all the tents down and get everyone into housing. We housed 61 people just this weekend. The week or 10 days before that, we had housed about 40 people. So we have housed over 100 people who would not otherwise have been housed over the last week and a half or so. This weekend was a major effort. All of my executive team was out working on this, along with our human service people. And of course, as I mentioned earlier, our appreciation to the volunteer outreach workers who are really so instrumental in assisting with this process. The parks, the 2 parks are closed for restoration is what I'm going to call it right now. You've all seen that in other parks. So we've got to do some grass cutting. We've got to do some restoring of some turf. We're also going in to clean those parks extra good, more than we do just on a regular daily basis. So they are, we're working on those 2 parks downtown. It'll take a little while for that to get done, not long, but though they're closed right now so that we can clean them very well and restore them. So that is a bit of success. As most of you know, the city of St. Louis has procured 230 new beds that did not exist before COVID-19. Those beds replace some of the beds that the normal shelter providers had to reduce their population. And so these 230 beds replace those. And we appreciate everyone's help in doing this. We know that the city has for a long time, let me start over on that. We, for a long time, have had many of the homeless population. I talked with many folks over the weekend, and our outreach workers talked with many folks. We know that a lot of the folks that we are trying to help and we want to continue to help are not from the city of St. Louis. Many of them are from St. Louis County. I talked to a gentleman from Wentzville. I talked to someone from Effingham, Illinois, and Peoria, Illinois. I talked to a group of people from Valley Park. I talked to someone from Springfield, Missouri. So a lot of folks congregate and come here because they know there are services here. And so we're looking for help from other cities, other counties, in order to help provide the services needed for our homeless population. Especially during a pandemic, they need to have a roof over their head. They need to have a roof over their head every day, but especially during a pandemic. Our goal is to move people from shelter into permanent housing, into an apartment, which is frankly a much more economical way to provide housing for people as well. So people need services. Some need mental health services. Some need drug services. Some need help getting a job. Some need very temporary assistance. So we have to, our caseworkers, we'll work with those folks in order to try to get them into permanent housing. What else, Jacob? Do we have questions, or is there?
We do have questions if you're ready for them.
I'm ready for questions.
One on the issue that you were just talking about. Where are the extra rooms that the city brought online for the unhoused community, and is there a wait list for to have access to them?
So I'll tick through them. I think I've done this before, but there are 3 churches that are providing among them 75 rooms. We have rooms at the Western Inn. We have that's 33 rooms. We have rooms at the Mark Twain Hotel downtown. That's about 24, 25 rooms right now. We have 28 beds at Booter Recreation Complex. That's a triage center where hopefully we can send folks out from there. We also have at what's formerly known as the Little Sisters of the Poor. It's now called Sisters Mission, so you'll hear it called both things. There are 26 plus 51. There are about 77 rooms there. So those are the locations that we've added. That adds up to more or less 230. Oh, and we have rooms. It's now 20 rooms at another hotel that we're also placing people in. So there are still rooms, there are still beds available in those locations. And so we are open to filling all of those beds.
Mayor, when you talk about the peak, is that specific to the city of St. Louis, or are you speaking regionally? And did you say we have hit it coming down?
When I talk about the peak, this really comes from the St. Louis Metropolitan Pandemic Task Force. They are the 3, Mercy, EJC, St. Luke's, SSM, VA Hospital, and our federally qualified health centers. And they are all inputting information and doing the modeling. And yes, I believe that it was last weekend, not yesterday, but the week before, where we hit the peak. Of course, you can't tell exactly until you look back at that. But yes, they do believe we have hit the peak. We are very hopeful that we can sustain that downward, even though it's very gradual. We are hopeful that we can sustain that downward trajectory in the face of reopening much of the state's economy. So we'll have to see how that goes. The incubation period on this is about 14 days, up to 2 to 14 days, it's said. And so, you won't see something instantly. One of the interesting things is that we did see after Easter, about 2 weeks after Easter, we did begin to see a little uptick in the cases. So maybe Easter people were not quite as, they weren't staying home maybe quite as much. Some of that is speculation, of course, but just looking at the numbers and looking back to what happened that 2 weeks ago, we're thinking that there's some correlation there.
Do you know how many tests are being done each day and when a person should be able to be tested?
So more and more tests are being done every day. I don't know the exact number. Last week, middle of the week, I got a number from the state that said that the city of St. Louis had about 7,500 tests done. And what we're hoping for is a time, and you all know that, I got to shut something on here, Jacob. Here we go.
Sorry.
Is that, how can I do that?
Let's do it.
All right. Something's popping up on this. There we go. Thank you. So, we continue to hope that these tests become more available and that then anybody who needs a test can. We're hoping to be able to test some of our high-risk population, hoping to be able to test folks in nursing homes and older folks' homes, hoping to be able to test first responders. There are a lot of groups of people that if we had the capacity to test, we would. Also hoping to do testing for, to sort of reduce the screening process for testing so that anybody who has any symptom at all may be able to be tested. One of the things that we know is that they're finding this in other areas where they're doing testings of big groups of people. You don't have to be symptomatic to have this, to test positive. So I read one study recently that about 10% of the people that were asymptomatic had tested positive. So until we get in this country, and this is a national issue, until we get really strong testing capabilities, we're going to be dealing with data that is less than we'd like to have. But we have what we have. We got to make the best decisions possible. We have to continue to socially distance. We've got to continue to wash our hands. We've got to continue to wear masks. I think we're in for wearing masks for quite a while. So,
the city's website shows that there are 0 pending test results. Does that mean that the city's not doing any tests?
No. So I haven't looked at the website today, but here's the situation. You can get the test run at a number of different places. At the state, we have 0 pending. If it says 0 today, we have 0 pending test results. But we may have pending test results from Quest or from LabCorp or from other private labs or from hospitals. So that's a little bit, when we started out on this process, the state was the only one doing testing. But since then, more has come online. So that's information that we're receiving from the state. So certainly we have people out there who had been tested and we don't have the results back yet. In addition to that, we have people out there that are being monitored. And you know, that is someone who has had a prolonged exposure to somebody who ends up testing positive.
Mayor Kyle is watching and has a question about the CARES Act, wanting to know if the city has any funds through the CARES Act and what the impact on the city budget might be.
So the city is supposed to get about $34 million from the state. That's through the CARES Act. We are a county. The city of St. Louis is also a county. We haven't received any of it yet. The latest we heard was maybe by the end of this week. So we have not received any of that. St. Louis County, on the other hand, did receive $174 million in CARES funding. They received their funding directly from the federal government because they have a population of more than 500,000. I will say that St. Louis County, if you do the arithmetic, they got about $175 per person, per population. City of St. Louis is slated to get only about $117 per person. We are in a lot of conversations and believe that residents of the city of St. Louis deserve every bit of the same amount per person as St. Louis County. It's not St. Louis County's fault. That's just our money had to go to the state and we're getting a smaller allocation from the state.
Robbie has a question for you, Mayor. Do you think the majority of people are going to stay home, or do you think that there will be an uptick in people breaking your stay-home order, and are we prepared to handle that? So
the stay-at-home order right now, let's say it's for the next, what's today, the 4th of May? Yes. So let's say it's for another 10 to 12 days. That would get us to around the 15th of May. And it might not be on the 15th, it might be on the 16th or the 18th or the 14th. So I'm not making an announcement here, but we're hoping that it'll be right around the middle of May. I think the longer this goes on, the more people are not staying at home as much as they were initially, and we may be seeing an uptick in the numbers as a result of that. But one of the very most important things is to socially distance and to wear a mask. Because even after we lift the stay-at-home order, you're going to have to do both of those things. And I think all of the docs have told us when we lift the stay-at-home order, we will likely see an uptick in the number of cases. It's a very, very serious virus with so far no medicine that really works and no vaccine. And the docs say we won't have a vaccine for maybe, if we're lucky, we'd have it by the end of this year, but it could be this time next year. So we just all need to really continue to be careful because it's a very serious situation.
Are you going to support keeping the casinos closed, or do you think they'll reopen?
So the casinos are a bit of a unique animal here because they are controlled by the State Gaming Commission. The State Gaming Commission last week issued an order that said that the casino should remain closed until May 15th. And after that, they should continue to follow local guidelines. They also, if you read the order, I mean, they may come back and extend it. They can change it at any time. So what the casinos have to do is what every business has to do. You have to be able to socially distance when you're in the casino, when they open, which I don't know when that'll be, a couple weeks, I'm guessing, maybe longer. But so what that looks like for them, does it mean every other slot machine? Does it mean every third slot machine? Does it mean, 3 people at a game table versus 6 or 7? All of that is still to be worked out. And frankly, it's worked out with the State Gaming Commission, but also the businesses themselves. Every business that I've talked to and that I know of is working through their own procedures in order to be able to socially distance, because they don't want to get sick and they don't want their customers to get sick. So this is all evolving.
What does the reopening schedule look like for the city of St. Louis? In other words, is there any guidance you're prepared to give various businesses about what they should do when they can reopen?
We know some things. When businesses can reopen, they have to be able to reopen in a way that is where you can socially distance. We also know that they have to follow the state guidelines, which are in place until the end of May. The state guidelines say that if you have 10,000, if you're retail, you have 10,000 square feet of space, then you can have 25% of your occupancy. If you have over 10,000 square feet, you can have 10% of your occupancy. So the state has issued an order. It's a pretty brief order. It's only 2 pages long, easy to understand. So that is the minimum. And then in addition to that, we are going to try to give additional guidance, recognizing though that these businesses, the types of businesses, they know probably better than we do here in the mayor's office how their business can operate. They're going to have to be able to provide for social distancing, and masks are strongly recommended.
Is there a plan for a second wave of COVID-19 in the fall or winter?
So there is a plan, if you will, for a second wave of COVID-19, although we're trying to avoid that second wave for sure. And that includes very serious, it never stops from now till we have a vaccine for this. It includes very serious testing and contact tracing. So if someone tests positive, we have to find out who have they been around, other people in their family, maybe people they've worked with, maybe people they've sat in a lunchroom with. Lunchrooms, by the way, it's big not to have those anymore, at least for a while, where people sit on a table and eat lunch. They're close to one another. Maybe they sit there for half an hour or so. So all of those are guidelines that we're trying to work out and trying to work with business to do that.
Is the city of St. Louis seeing the number of recoveries increase?
We are seeing the number of recoveries increase. And the way that's measured is really the number of people who get discharged from the hospital. Because if you have COVID and you're at home and you never go to the hospital, well, then you likely are recovering, but you're hard to count. Unless you've been tested, of course. If you've been tested and you never have to go to the hospital, then you recover. So yes, most people do recover from COVID-19, but 67,000 people in the United States, this was yesterday's number, have died of COVID-19, 67,000 in the last couple of months. That is more people than died in the entire Vietnam War. And some of you watching are old enough to remember the Vietnam War. Some of you aren't. But when you think about the fact that that war went on for years and we lost way too many young people in that war. But in just the last couple of months, the deaths in this country from COVID-19 are more than the deaths were in the whole Vietnam War. So it's a little perspective.
Exercising outdoors. Someone's asking if they're allowed to do that.
Yes, please exercise. I need to go do more myself. Outdoors. If it's unpredictable about whether or not you'll be close to someone, wear a mask. If you're in your own yard or something like that, that's a different situation. But
On a related note, is mask wearing mandatory yet?
Mask wearing is not mandatory. Here's what, it's mandatory that employers provide masks for their employees. And it is strongly recommended that you wear a mask when you go out in public with other folks around. So it is not mandatory, but it is strongly recommended. You know, we try not to put rules in place that we can't enforce. For any of you who have access to, you know, a few extra surgical masks or even bandanas, or those of you that are making masks, which, by the way, thank you very much for that. You know, try to carry some with you and offer them to people. I was outside all weekend, mostly downtown here at the encampment, and we saw people that didn't have masks and said, "Hey, do you have a mask?" Some of them said, "Yeah," and it was in their pocket. I was like, "Oh, could you wear it?" You know, so try to help out. If you have access to some, provide other people with them. Just they wear them.
Mayor Katrina is watching and has a question about being able to have a small wedding in June.
How small, Katrina? So June's only a month away, and you will still, I'm pretty confident in saying you will still have to be socially distant. I don't know what the gathering size will be in June. Fingers crossed, maybe it would be 50. But I'm guessing a bit there because those are guidelines that we haven't all agreed on yet.
She says 30.
30? Hope so. I hope so. Keep planning.
Jeff is watching, Mayor, and has a question about support for small businesses and if the city is going to put together any sort of grant or loan program to help support them.
We are. We have already put together grants of $5,000. And those were early on. Those were sort of bridge loans till people got to the grants till people got to the PPP. And if we can get the full funding that we should be getting from the CARES Act through the state of Missouri, we will also do more small business grants. I know that St. Louis County announced, bear in mind, St. Louis County got $174 million through the CARES Act. So far, we haven't gotten any. We're expecting $35 million. So for the county, it looks like they'll make about $15,000 grants, up to $2.5 million in total that they have allocated. That would get about 165 businesses or so if they all got the $15,000. We hope to do something similar to that. You know, we have a lot of priorities: PPE. We have testing, of course. We have a fair amount of money spent on homeless housing that wasn't anticipated. So we also want to do rent assistance. We have a long list of things that that we need to do with regard to that. And on that list also is loans to small businesses.
A couple of questions about summertime events in the city that are really popular, like Pride St. Louis, Taste of St. Louis, Q in the Lou, things of that nature for the summer.
So that is a little up in the air right now. I know that Pride has rescheduled the Pride Parade, and it's normally at the end of June. I think they've pushed it off a couple of months. We're learning more every day about those things. Q in the Lou is a big outdoor barbecue festival that's downtown, lots of fun and lots of good food. If I'm not mistaken, it happens towards the end of September. We're going to know more. We're going to learn more between now and then. So right now, it's not a yay or nay. It's let's wait and see. I would plan for those things to the extent that you can, but we got to wait and see on that, especially if we're in the midst of a second wave.
Couple more questions, Mayor. Someone's having trouble with their unemployment benefits.
Mm-hmm.
Who would you suggest that they contact for that?
So I don't know what trouble you're having, if you're having trouble getting through or if you've been denied. My first suggestion, and maybe you've done this, is to go online, because you can apply online and you can get a lot of your questions answered online. If that doesn't work, of course, calling in, and I know that that line is busy a lot, so you want to call in early in the morning, I'm told. And so I think, you just have to work through that. The state unemployment office has added many, many more people. And so from what I am hearing, it's getting a little better. But still, they're pretty overwhelmed by the number of folks who need unemployment right now. So I would keep trying to contact them. If there's some unique situation, you can call our office. I don't know that we're going to have an answer for you because it's just not something that we process. Call the governor's office maybe and see if you can get some help there.
This is a non-COVID-19 question.
Okay.
Is the city of St. Louis filling potholes?
Yes, we are filling potholes. We are actually paving today, although I'm looking out my window. It's about to rain on it, I think. But so we began, it needs to be hot for paving to really work that well. That's not something that I ever knew before. But so when it's hot, that asphalt goes down and sticks down a lot better than when it isn't. But yes, we are filling potholes. You can still report potholes. And we're also doing some paving now. We're hoping to get some paving done before a lot of people come back to work. This is earlier. May 1st is May 4th today. Way earlier than we would normally do any paving because we like to wait for it to get hot. But this was one of those situations where, okay, it's hot enough. We think it's hot over the weekend. We did work one day over the weekend, Saturday. And so trying to get some paving done now.
Patricia's watching, has a question
Patricia.
about schools, wanting to know, because they lost so much time this year, do you think that they're going to be opening up earlier in the fall to make up for that time?
I know that some districts are talking about opening earlier, but to my knowledge, they haven't made any decision about that. School, last year, the Missouri legislature passed a law that said you couldn't start school until like the week before Labor Day. A lot of schools, as you probably know, prior to that, started around the 10th or so of August. So there are districts that are thinking about starting earlier than that. But as far as I know, no one's made a final decision yet. They're just, we haven't even opened up the economy yet. We've only been doing this for, 2 months, not even 2 months. And so when you think about, we've got June, July, and another 2 months here, and we're going to have to see what happens.
Okay, last two questions, Mayor. Can Metro stop enforcing fares as a way to try and keep their security workers safe during COVID-19?
Well, Metro did that a month ago. Maybe I don't know if you're talking about the train or the bus. I know Metro buses did it about a month ago. I believe they are in the next week or two going to go back to collecting fares if they can figure out a safe way to do it. The real thing there is to protect their drivers. But understand that Metro's revenue, the only way they get revenue is either from the fares, which actually don't.
And in the north suburbs, 11.9%, or 27 actual beds. Now, that's a whole lot of numbers, I know, so I want to remind everyone that if you want to check out our hospital utilization data in your area, you can find that information laid out visually on the IDPH website, dph.illinois.gov. And remember, these numbers fluctuate not just day by day, but hour by hour. Finally, I'll briefly touch on ventilators. Our medical professionals continue to innovate treatments to help patients avoid the need for a ventilator, though this equipment can and has saved lives. It begins a very difficult recovery when people are intubated, and it's no doctor's first choice. That said, we continue to keep our eye trained on the number of Illinoisans with COVID-19 who are on ventilators. And from a statewide standpoint, we've continued to see a slight downward trend on this metric from 29% usage on April 6th, then 25% on April 14th, then 23% on April 26th. And of the 4,493 Illinoisans in the hospital, 763 are on ventilators. And that means 22% of our total ventilator inventory is currently in use by COVID-19 patients. That's a lot lower than we had expected at this point, and it's because of the amazing work that people have done staying at home and following our executive orders. I want to again make a call to our workers in nursing homes, hospitals, clinics, law enforcement, and other frontline occupations to help us stretch our PPE stocks further through the use of our new N95 mask decontamination system that's currently deployed in Waukegan. This is a fully free service, door to door. FedEx and Cardinal Health are handling the transport of masks from facilities to the decontamination site and back. And the U.S. Health and Human Services Department is covering all the costs of using this system. Each mask can be contaminated up to 20 times without experiencing any degradation of filter performance. So I want to encourage facilities that have masks to send them for decontamination to our Waukegan facility. I highly encourage people to take advantage of this equipment that's being provided through IEMA. And again, it's fast, it's free, it will help us help you by freeing up PPE as we're acquiring it from abroad. IEMA is ready to assist with the sign-up process for your facility, and they're available 24/7. To register, these facilities must enroll at www.battelle.org/decon. Again, that's Battelle, battelle.org/decon. DECON. Before we move to press questions, I want to let everybody know that today kicks off Teacher Appreciation Week. Educators have long been a special type of unsung hero, dedicating their lives to giving the next generation the tools they need to build a better world. And now, in this pandemic, millions of teachers have stepped into new roles as meal distributors, as tech support staff, 3D printers, YouTube stars, lesson innovators. They're only human, doing their best to do their jobs and to see their students through an unprecedented situation. And by and large, they've shown us their extraordinary compassion and creativity, and I'm so grateful to them. To all the educators watching, thank you for stepping into a role that you may never have expected that you would need to fill, all the different roles that you're filling right now, and I'm so very grateful to you. If you're not a teacher but you know one, I hope you'll take a moment to thank them today, call them, send them a note online. A few kind words goes an awfully long way, so I would appreciate if you'd reach out to them today. Thank you, and now I'll be happy to take any press questions. Dana.
Hi, Governor. The first one is from my colleague at CBS 2, Chris Ty. Yesterday, the pastor at the church in Lena, Illinois, had services with dozens of people attending. Will Illinois State Police enforce the court ruling next weekend, or will you request the county do something to enforce that order?
We have always asked local law enforcement, local officials to enforce these orders. And the best way to do that, of course, is a reminder to the pastor and to the parishioners that they're putting themselves and others in danger by holding a service like this. The pastor filed suit. That suit failed, and it's because people do have the ability to worship. And we're trying to simply keep people safe during this time of a global pandemic.
So will you urge, I'm sorry if I missed it, will you urge local officials both in Chicago, which was going to bring me to my next question, and in any other county that is defying the gathering, the stay-at-home and the gathering order of no more than 10 people, will you urge authorities to step in and do something more than disperse?
Well, we're asking them to disperse. I mean, that's the most important thing. We just don't want people getting sick. It's not an intention that people will go to jail. I will say, however, that if people are persistently defiant, they can be put in jail. And I'm not suggesting that that's the best answer or the first answer, but it is something that's an option for local law enforcement.
And following up on that, a question from Eric at ABC 7. There were nearly 1,000 CPD dispersals over the weekend, but 0 citations. And you, of course, as you just said, you defer to local authorities. But what's your reaction to that number of dispersals in Chicago? And what do you feel needs to happen? And does it concern you that this could lead to a resurgence if this continues?
It does concern me. And people should really understand that if our numbers flatten and get better, and that's where we seem to be at right now, it's because people have followed the rules. And to the extent people are not following them and gathering in groups, they're going to spread the virus, and they're going to cause us to go back into a previous executive order or a more stringent lockdown than what we've had, if in fact there's a spike of cases as a result of people not following the rules. So again, we want to encourage people to do the right thing. I'm sorry that the police have had to break people up like that. I know that it's attractive when the sun is out for people to go out and gather in groups, but I want to remind everybody that it's a mistake. Right now, the only way that we can defeat this virus, because we have no vaccine and we have no treatment that keeps people out of the hospital. And so the result is the only way we can fight this virus is really by obeying social distancing, obeying the orders that have been put in place.
Would you like to see more citations issued as a deterrent?
That is not something that I prefer. But as I say, if people are being persistently defiant, I do think that local law enforcement needs to step in. But it's up to the mayor and it's up to the local law enforcement to make those decisions.
I'm going to combine a couple of unemployment questions, one from Samantha Chapman at WLS and one from my newsroom. And the bottom line is we're receiving, as I feel I say to you every time I'm here, we're receiving literally dozens of complaints almost every day about people who can't get onto the system. They get kicked off the system. No one answers the phone. They have debit card problems, and you have said, well, we're updating the system, but these folks continue to tell us, well, it doesn't seem like it. Mm-hmm. So what specifically is being done right now to make sure that the acting director of IDES is doing what he is supposed to do to help these people who are desperate?
Yeah. So let me begin by saying that we obviously are deeply concerned about anybody that is owed unemployment and somehow can't file their claim. That is not something that's intended, and we're certainly trying to work through any problems for people that have been persistently having difficulty. I will say that that the system is, I get the numbers of processed claims every day, and the numbers of people who are being processed every day are very frequently in the tens of thousands, which is vastly more than ever before. In fact, it's a multiple of what even was occurring on a weekly basis and daily basis during the Great Recession of 08-09. So there's an awful lot that's being processed. There's also a multiple of phone lines that are being answered for people who are calling in. It's still not enough. There are some people that call in persistently, have to wait for some time on the phone before they can get a hold of anybody, or because there's a limit to the number of people who can answer phones, they may not get a hold of somebody on a given day. I would encourage everybody to go online. That is how most people are, multiples of people are actually getting through and filing their claims. So that's what I would say. I mean, we're doing I will say that the acting director and everybody that's working at IDS is working overtime to make sure that it's working as best it can, and they are working through. There really isn't a backlog at this point. So people who are having trouble, there's typically an issue with their claim, which I understand they need to use. We have online tools that they can use. Even if they can't sign up online, there's a chat function, there's an ability to message to IDES to let them know what your issue is and have somebody get back to you about it. And I would just say one more thing, sorry.
Yeah.
Dana, just that later this week we're going to review where we are with unemployment, so you'll have a much better, more holistic view of how we're doing and what we're doing, what we've done to address these issues.
Have you ever thought of having the acting director, Chan, come here so we could ask him directly, questions directly?
I haven't, but I've been focused, as you know, here, for the most part, on the directly addressing the virus.
Of course. Question from Craig Wall at ABC7. Thoughts on people who have been going into Indiana over the past few days for services they can't get here? Your reaction to that?
Again, I think, to the extent that people are not social distancing and accessing services in which, Indiana may have decided that they want to open those things up, understand that there are risks associated with that, and I would discourage people from doing it, but understand that, people are free to do what they want as they may leave the state. I don't control the state of Indiana, and they don't control Illinois, but I'd rather be from here than there.
A question from Marianne Ahern. Even Governor Cuomo today says he's looking at opening regions of New York State on May 15th. Will you consider reopening regions, and if so, what is the criteria?
Yeah, so we'll be talking more about that, but suffice to say that I absolutely think of the state as, we have a lot of different areas of the state, different population densities and so on. The most important thing, though, that I have pointed out to people is to think of the state not in the typical way that you think about regions, but rather about healthcare regions. To think about how many hospital beds, and that's why I talked today about how many hospital beds does a certain percentage availability mean, because a spike in one area that happens to have 25 hospital beds available or 25 ICU beds available, if there's a significant spike in that area, 25 is not a big number, and so what we want to make sure is that we are able to handle a spike, because that's what potentially could occur if we reopen things too fast. And as to the setting a date, it sounds like another governor set a date for. I will say that it really needs to be based on data and metrics. My guess is, knowing that governor, that he was really talking about hoping that might be a date in which they could do it. But you really need to do this based on the data, and that's what we're following very closely. And I want to open it as fast as anybody does. I just want to make sure that we're doing it in a safe fashion.
Follow-up question with that and the data in mind. Do we have to wait till May 30th to hear what your phased-in reopening plan is? And could you disclose some of the details before May 30th, or do you plan to?
You don't have to wait till May 30th. We've been thinking about this and working on it for some time now to make sure that we're going to, give people a view into, how and the phases might work and how many phases there are and what would work in each phase.
Okay, sorry, I'm trying to.
It's okay.
My pen ran out, so my normal organization method went out the window. Question from Amy Jacobson at WIND Radio. We learned Friday after your press conference that you and Mayor Lightfoot have decided to deconstruct McCormick Place. Has the process already begun physically, and what's the total number of patients who were treated there?
Let's just back up. I want everybody to remember why we built out McCormick Place. Virtually every model that was built for the state of Illinois or about the state of Illinois early on showed that there would be many, many more people who would be hospitalized, depending upon how adherent people would be and to the orders that we put in place, depending upon how strict the orders were, that we could bend that curve, but nobody really knows exactly where we're going to end up here. The fact is that because we haven't had to use the beds, as many beds as we thought, and in fact, most of McCormick Place we haven't yet had to use, that is an indicator of the success that we've had both at issuing the stay-at-home order and at getting people to adhere to it. And I'm very proud of the people of Illinois, people of Chicago, too, for following that and making that possible. So as it regards, how many patients, I think the total number of patients that have been in there at any time is about 29 or 30. I'll get you the exact number. And thank God for that it's only that number. Again, it was built out for a reason. It wasn't built out because anybody wanted to stop the commerce of conventions at McCormick Place, but rather because we wanted to save people's lives. When will it be deconstructed? Well, we're obviously keeping a portion of it live and working in the event that we have a surge during the next, number of weeks. But our hope is that over the, after a few weeks from now, the last piece of it, which is actually the most useful piece of it, this is Hall B, which has been designed to have negative pressure in the rooms for, more serious COVID patients. That hall would be the last thing that gets taken down.
But has there actually been physical removal of
I
some of the
believe
beds?
so. I know that's the intention, and I haven't seen pictures or gotten an update recently, but that's certainly the intention. That the hall that had 500, the first pictures that everybody saw, which was Hall C, had 500 beds erected in 5 days, because remember, the curve was not bending at that time. And so those are being taken down.
Okay. One more question from Amy Jacobson. There's hundreds of thousands, as we know, of Illinoisans out of work. Many, she says, want to become contract tracers. Where and how do they apply?
Yeah, so we'll be giving that information shortly. We want to make sure that we have a system that's up and running for accepting those applications for contact tracers. We're very much looking forward to building up a workforce of thousands that'll help us.
Another question from Eric at ABC 7. Are there any regions of the state where the R0, it's the figure I guess you used to calculate rate of spread, okay, where the R0 is below 1, and if so, what are those areas? And again, as I've asked, though, might those areas begin to open before May 30th? But what are those areas?
Yeah, so we aren't doing enough testing across the state now. I want to remind everybody, we're the second most amount of testing among the top most populous states, the top 10 most populous states. So we're doing a lot of testing, but no state is doing enough testing. We need to vastly increase the amount of testing that we're doing, again, even though we're doing a lot. But it takes a lot of testing in order for us to get to an R0 number. But we do have a statewide number because of the number of tests we're doing statewide. That number is down to about 1.2. We're certainly trying to keep track of what's happening in each and every region so that as things are coming down, more things can be opened up.
A question from Greg Bishop at Center Square. Is reopening the state's economy conditional on the implementation of a mandatory tracing program, or for the mandatory tracing program to be completed? And if so, how long is that anticipated to take?
I'm not sure what Greg means by a mandatory tracing program, but the tracing program, the contact tracing program, is being worked on and built up. Its completion is not a precondition to phases, but contact tracing is critically important for certain industries, especially to make sure that if people can't maintain social distance in some circumstance, then it's a situation in which, we would need a lot more contact tracing, for that kind of an industry to make sure that people aren't spreading it asymptomatically. So I understand the question. It's not a mandatory contact tracing program, but it is a program that will help us to diminish the spread, and we are trying to spin it up as fast as possible.
Another question from Greg. What's your recommendation for local governments eyeing revenue losses? Should they be laying off staff and cutting budgets now, or should they follow the state's example of no furloughs and no immediate cuts?
Well, I think a lot of assumptions in there. I'm not going to tell local governments what they should do to meet their budget requirements, but what I am doing is working hard to make sure that in Washington that they understand the damage that's been done to all the states and to all of the local governments, and particularly smaller local governments which really didn't get very much out of a previous CARES Act. We need to make sure that we're helping them so that they don't. Remember, you know, it's easy to say, well, gee, you should furlough a lot of people in order to deal with their budget problem. But remember what happens in a pandemic like this. We have a decreasing amount of revenue coming in and an increasing need by people for the services that states and local governments offer. And that's why we need help from the federal government to preserve those services.
From Barb Markoff at ABC7, one of the plans being floated to reopen the country is to pivot our focus on protecting everyone to focusing on the most vulnerable. Is that something that you are considering as we continue to proceed throughout the month of May?
Well, we are protecting everybody. Everybody's life is, you know, is valuable, and but I will say that that we already are making extra effort for those communities that are most vulnerable. You've heard a lot about what we're trying to do to protect people in congregate settings, which are often the most vulnerable. Right? These are people who are physically or developmentally disabled. They're people who are elderly and may have other existing underlying conditions. You've seen that we've spun up more testing in areas where there are large African American populations or large Latino populations, which have a propensity to have comorbidities or a higher rate of positivity. So we're working on those populations that are most vulnerable even now, and we'll continue to do that as we begin to open things up.
And I think what you meant was, might there be a shift as we move forward from the stay-at-home for all to making sure we focus on the most vulnerable only as a part of a reopening?
Well, sure. I mean, I think we're shifting. I mean, that shift, when you say shift, I mean, I'm not going to shift away from protecting everybody, but this idea of shifting the stay at home and saying only these people have to stay home, I guess that's everything is evolving. That's what I would say. And obviously, at some point, we're not going to have the same order in place that we have now, and we're going to be loosening things up. But as we do that, we're going to be still paying extraordinary attention to those who are elderly and in these congregate settings. I didn't mention, of course, the staffs in those settings, and even in our prisons, the staffs in our prisons as well.
Question, it circles back to McCormick Place from Charlie Wojciechowski at NBC5. Regarding McCormick Place, was it too much too soon or a necessary precaution?
It's interesting if you go back to the day that we talked about the stay-at-home order on March 20th, and Dr. Emily Landon stood here. She said the most remarkable thing about the success of a stay-at-home order is that nothing happens. And that's really, this is a function of, guess what? A lot of people didn't get sick and a lot of people didn't die. And so that's what it means that we have, that we spun it up, because at the time we didn't know whether we'd be bending the curve properly. And it turns out we have. And so thank goodness. And I said early on, my prayer is that we won't have to use McCormick Place or any of the alternate care facilities. And it's still my prayer. People, I want everybody to understand, we're not through this yet. We're not done with this. The virus didn't go away. It's still out there.
There are some wondering where Dr. Ezeki is today.
She had a family matter, so she's with them.
Well, I will ask you this last question from Marianne Ahern. It was for the doctor, but there are health regions with low positivity rates. Mm-hmm. You've touched on this. Do you recommend reopening those regions?
Yeah, again, those are going to be pieces of how we think about each region and what can open. So thank you. Yeah.
Thank you.
Okay. Hannah at the Daily Line. According to movement tracking data from Google, most of the stay-at-home behavior changes asked of Illinoisans, like not going into workplaces, avoiding public transit, going to grocery.
Good afternoon, and thanks again for joining us today. As of 2 p.m. today, there have been 8,754 positive cases of COVID-19, including 358 deaths. Over 92,000 people in Missouri. So there's been a lot of information this weekend on the testing, especially at the Triumph food processing plant up in Buchanan County. One thing, and then Dr. Williams will talk about this in more detail when he comes up this afternoon, but just a couple of things I just want to make sure that everybody understands. When you pick a particular plant like that one was, that we did all the testing, we did about 3,000 tests in that plant, and we come up with 300 plus that were positive. Those people are all in quarantine now, which is the good news, so we've got them separated. But I also want to mention we did 3,000 tests, roughly 3,000 tests over the state of Missouri randomly over the weekend also, and of that 3,000 tests, there was 9 come back positive. So I think you always have to remember what the locations are, and again, you have to take all the numbers as a whole to see how it affects the entire state. So I think that's important that everybody kind of needs to understand that's going on also. And we'll talk about that. Dr. Williams will talk about that when he's up here a little bit. But today, phase 1 of our Show Me Strong recovery plan took effect, and we are prepared and ready for this next step. But as businesses reopen and Missouri's re-engagement in the economy, I want to remind everyone to be safe, to be smart, and to be responsible. We are on the road to recovery, and we must continue to be proactive and maintain social distancing to protect ourselves and everyone around us. Earlier today, Teresa and I visited businesses in southwest Missouri to discuss our recovery plans and learn more about how they have adapted to the COVID-19 crisis. And it was encouraging to see how these businesses, as well as so many others across Missouri, have adjusted to these challenges and precautions they are taking to keep employees and customers safe and moving forward. One of the things is we went to the businesses around the state today, and you've seen some of the things they've implemented in. One of them was CDL over in Joplin. We went to a pretty good-sized business, heat and air business, where how they had adapted for their employees to go meet the customers and what they had done for their employees, whether it be masks, whether it be protective gear, whether it be the hand sanitizer, everything they had put for those people that are still working that worked during that time, along with what they had available for the customers. I know we went to a DAV shop also in Joplin over there where they sell items, and which was a fairly significant business there. Most of the employees there were wearing masks. They had the opportunity to wear a mask if they so choose to do that for them waiting on the customers there today. And I think as we went to Springfield, again, we was at Bass Pro. Again, a lot of the employees there were wearing masks today that there was going to be there in those shifts. And then we went to Cox South, that most of you know. And at that point, when you went in there, we were required to wear a mask. So me and the First Lady both put a mask on to go into that. I think it's important when you look at some of the things that they were doing as far as like in the retail businesses, they were actually had shields up for the cashiers to the customers that come through. There are a lot of innovative things, a lot of markings, a 6-foot distance. So I was really pleased to see the efforts, one, the businesses were putting forward, and really that people were understanding how important it was that social distancing was going to be part of our future for a while. So I think that's important. I think the other thing, there's been a lot of discussions about masks. Do you wear a mask? Do you not wear a mask? A lot of information on both sides of that. But I'm going to go back to what I've said all along. It really goes back to your personal responsibility. Do you want to wear a mask? Do you not want to wear a mask? If you're going into a business and they want you to wear a mask, then wear a mask or don't go in the business. If you're working there and you feel comfortable wearing one all day long, then by all means, I think the businesses should provide that mask for you if you're employed there and you feel safe. So let me just cover some of those things, but it was really encouraging to see the businesses really working and what they were expecting out of the customers coming in there. So it was a good way to start Monday off. It was good for me and the First Lady to be out there, see firsthand what was going on and some of the things that everybody's trying to put together to open up the economy here in the state of Missouri. Throughout the COVID-19 crisis, I have signed multiple executive orders to assist our response efforts. Today, I signed executive orders extending 4 of these previous orders through June the 15th, including Executive Order 20-04, Easing Regulatory Burdens, Executive Order 20-5, Allowing the Sale of Unprepared Restaurant Foods to the Public, Executive Order 20-06, Mobilizing the National Guard in Response Efforts, and Executive Order 20-08, waiving the requirement of a person to be physically present in front of a notary public. These are all extended. These orders through June the 15th is consistent with the state of emergency extension and gives Missouri more time to adjust to the reopening. Today, we will also be distributing the CARES Act funding to local governments. COVID-19 has had an overwhelming impact on our economy, and many local governments, healthcare providers, education institutions, businesses, and other groups will rely on this funding. As we work through this process, I want Missourians to know that we'll be as transparent as possible. As of April the 10th, I established an informal working group led by State Treasurer Scott Fitzpatrick to help make recommendations on the best use of this federal funding. The Treasurer's Office has also established a web page to provide updates on the working group and CARES Act funds. We hope posting this information in one public place will help Missourians stay up to date and feel confident that we are working hard to make every dollar count for the people of the state of Missouri. Today, Treasurer Fitzpatrick is here to provide us an update on that. Scott?
Thank you, Governor. Good afternoon. As you know, several weeks ago, Governor Parson appointed me to chair an informal working group to make recommendations for the use of federal funding provided for COVID-19 related expenses under the CARES Act. Last week, the working group on Tuesday held a public meeting to discuss a certification form for local governments to sign, as well as to fine-tune the distribution amounts that would be distributed to those local governments as outlined in the supplemental appropriations bill passed by the General Assembly and signed by the governor. The governor, the same day, quickly reviewed and approved both recommendations from the working group, following which my office distributed the certification document to all the counties in the state of Missouri, as well as the city of St. Louis. As of this afternoon, payments have been processed to 105 Missouri counties and the city of St. Louis, payments totaling approximately $468 million. This means that those local governments are going to have access to that money in their accounts by Wednesday. Over the past week and a half, my staff and I have made hundreds of phone calls, making direct contact with Missouri counties regarding these coronavirus relief funds. To date, 7 counties have not yet submitted completed certification forms, and those counties will not be eligible to receive their funding until they do return that form. So far, those counties are Osage, Platte, Randolph, Stone, Sullivan, Clinton, and Clay. It's worth noting that I believe Platte County is meeting later this week and is expected to return theirs, and we've been in discussions with Clay County over some challenges they've had with some of the language, and we'll be addressing that. I want to urge the leadership in each of those counties to work together and submit their certification forms as soon as possible, and to contact my office if they have any questions or concerns. Because there's been some confusion in the press about why the city of St. Louis is receiving funds directly from the state and not the city of Kansas City, which is the state's largest city, I'd like to take a moment to discuss this. The CARES Act passed by Congress allowed for local governments with populations over 500,000 to apply directly to the federal government for aid. In Missouri, Jackson County and St. Louis County made that cut. Kansas City, unfortunately, fell just short of the required 500,000 person threshold using the 2019 population estimates as required by the CARES Act. Unlike Kansas City, which is located within 4 separate counties, the city of St. Louis is unique in that it is a city that is not within a county. The city of St. Louis is not part of St. Louis County, and as such, it's eligible to receive its own portion of the state funds directly from the state, as written in the supplemental appropriations bill that was approved by the governor. So I'm proud of how quickly we've all worked together to get this money to Missouri's local governments, and especially appreciative to the governor for his quick review and approval of those disbursements. Missouri has been a national leader in distributing these funds to local governments this quickly. It's my understanding in discussions on calls with the National Association of State Treasurers that other states are planning to use the certification form developed by the state of Missouri as the basis for their own distributions to local governments. I want to thank the General Assembly, the members of the working group, and Governor Parson for making that quick disbursement possible. As the governor said repeatedly throughout this crisis, local leaders understand the needs of their communities better than state government. Getting this money downstream to counties will help ensure it will get to those who need it quickly, whether that's the health departments, healthcare workers, first responders, or even small businesses that have been impacted by closures in their counties. We're counting on our county leaders to work with other municipal governments within their counties to ensure these resources are put to the best use for citizens of the county. And this is a time to come together for the common good of Missourians. I do want to thank the county leaders. I talked to several of them myself, as well as the ones that were talked to by my staff, and they have all almost 100% of them have been enthusiastic and willing to step up to the plate and help be a hub for distribution of this money in their counties. They understand the requirements that go along with that, and we're looking forward to continuing to work with them. I also want to highlight the governor mentioned the webpage on the Treasurer's Office website that has been launched to provide information regarding CARES Act funding. Will be, as more information becomes available, we'll continue to update that website. And you can access that by going to the homepage at treasurer.mo.gov, and there's a link right there on the homepage to that website. We all want Missouri families, businesses, schools, and communities to thrive, and we have to work together to get Missouri back to work, and I'm thankful for the governor's leadership in doing that. Thank you.
Scott, thank you very much. Thank you for the work and your team over at the Treasurer's Office. I might want to add to, we were very fortunate to have the State Treasurer to be able to help with this format. One of the things we all know as we look back at COVID-19, it seems like it's been here months upon months upon months, but really it hasn't been here 60 days yet as we know of it, since it's really all started for our state, our reactions. A lot of things have happened within that 60-day period, all the way from all this federal money coming in, unprecedented. When the federal government acted as quick as they did and they shipped that money to the state level. It was important for us for day one to reach out to the Treasurer. We knew he was going to be distributing that money, to be part of that process, to make sure, one, that we took our time to get it right, to make sure that distribution was going where it was intended to go, where it was supposed to go. And the other thing, that we were transparent about it, that we could put that information up almost immediately once we did. I think last week when you seen what happened when the disbursement of the counties, I think they had a meeting shortly after that. Again, the media had that information. They were able to put it out to the general public. And you will see us moving forward of all of that federal money that comes in to make sure, one, we're taking the time to make it get distributed correctly, and two, that you'll have opportunity to see that, not only you as the media, but also the general public will have the opportunity to see where every one of those dollars goes, because that's going to be important to us. Let me just say in closing, I've said many times, this reopening is a gradual process. Things are going to look different for a while, but we are on the right track. It is encouraging to see businesses safely reopening and abiding by the guidelines. And we must continue to prioritize the health and safety of our families, friends, and fellow Missourians throughout this process. So again, use common sense, social distance, make safe, smart, and responsible decisions. We have a long way to go, and if we keep up these efforts, we will recover from this challenge. Thank you, and God bless. Kelly, let's open it up for questions.
Hello, Governor. I know that you mentioned masks before,
Right.
and you went to the DAV in Joplin, and there were a lot of veterans who were wearing masks.
Right.
Why did you personally not wear a mask?
I chose not to.
When the public goes out of their houses because it's Monday and the loosening of orders happened today, do you encourage the public to wear masks?
I think it's up to the individuals. I don't think that's government's role to mandate who wears a mask and who don't. I think it works perfectly simple. The business owners there provided masks for the employees. They want them to wear them. That's the way it should be. If you want to wear a mask and you go into business, then wear a mask. But if you don't, I don't think it's government's place to regulate that. I think everybody, again, I'm going to go back to what I've said all along. It's your personal responsibility. Just like you wearing a mask here today, you want to wear one. Nobody required you to wear it or not wear one today. You want to do that, and I think every individual should have that freedom to do that. Again, common sense, self-discipline, your choice.
The state does recommend, though, 6 feet of distancing, but especially in large gatherings. But if you go one floor up to the Missouri House of Representatives, there's a lot of people packed into a not big enough room, and a lot of them are not wearing masks. Do you have an opinion about that? Do you think that there should be social distancing there and masks?
Asked and answered. It's up to them. If they want to wear a mask, wear a mask. I believe they're essential to be in here to be working right now. So if you wear a mask and you're in that position, there's guidelines that tells you what to do.
In your opinion,
but the
though,
House of Representatives need to make that choice, not the governor's office for them.
In your opinion, though, are they violating the social distancing order?
In my opinion, they're doing what they took an oath to do, to be here and represent the people of their districts.
Governor, I know this is day one, but come May 31st, what would success look like to you in terms of this first phase? And do you have a timeline yet for phase 2?
Yeah, you know what? I think the next 2 weeks are really critical. I know the order goes to the end of May, but I think to see where our state's going in the next couple of weeks, one, I think you go out like today and you say, okay, are we really abiding by these orders? Are we doing what they're supposed to be? There's going to be incidents, I'm sure, where there'll be a group of people together that shouldn't be together. We all kind of know that. But the reality of it is, I believe most of the people here understands the significance of this and how serious it is still with this virus, because that virus is still out there. It's not going to go away. People are still going to get sick, and some people are going to die, and that's just the truth of where we're faced. But we got to do both. We got to open up the economy, and we got to be able to fight the virus at the same time. But I really think I will look at the data each day, as we have for a month now, to see where we're headed towards the middle of the month and then where we're at to the end of the month. You know, again, it'll be a slow process to make sure that public safety is at the forefront of the decisions we make.
Governor, we saw 368 new cases today. It's the highest single-day jump. Do you still think that reopening today was in the best interest of the state, as we have not seen that continual 2-week decrease in case numbers here in the state of Missouri? I do, because again, you have to take the numbers across the state over a time period. If you use that number like you just used it, it sounds plenty bad. But if you really put it in the context that over 3,000 of those tests were done at Triumph Food Services up there, and 300 and some of them were tested positive, or whether you say the 3,000 we did at random in the state, there was only 9. So it depends which store you want to put, or do you want to put them together. Depends how you want to do that. But I think the important thing to do is why I think these briefings are so important, because people need to understand that when the reason we have hot spots, the reason we target those places to go in there and do that massive testing in those places. And it worked exactly what we wanted. Do we want 300 and some odd people test positive? No, we don't. We're fortunate they were asymptomatic. But the reality of it is we could go right away and we could isolate those people. And then if you look at the 754 positive cases, that's a total since day one. Out of how many tested, do you know?
Pardon me?
Do you know of how many have been tested since day one?
92,000.
92,000.
Yep.
Can you talk about, if you look at the graph that is posted on the Missouri Health Department's website, it is not a gradual curve down. There are ups and downs. So what does it mean to see a 2-week decrease as the White House is recommending? Yeah, I think we pointed out, Dr. Williams talked to that, but if you look at, again, you look at the hospital, the bed space, for example, ICU beds, ventilators, there's lots of things that go in that, but I think we met all 4 of those guidelines. But I'll let Dr. Williams address the models more, or the graphics that you're talking about, maybe better than what I can. But we believe we are on the downside of this virus here in Missouri. Is there other data that the public could see to have a better understanding? If they aren't understanding that graph that doesn't show a decline, what data should they look at? Yeah, I think so. We have that data. I think the Department of Health has that. We've worked on a model ourselves, and I believe if that's not all of that been released public, it will be, that we've been building. I think with WashU, MU's had a place to play in it. We've had a fusion team that's helped with that across the state, but we have all that data that's in there that I think will be available to you. If it's not now, it will be.
I'm Veronica Moreski, the Columbia Missourian. Does the state have any indication on the number or percent of Missouri businesses that open their doors today?
Not that I'm aware of. Not that I'm aware of. I'm going to say, again, I'm going to go back to the reopening. We've always talked about this was going to be gradually. But I think some businesses are going to choose not to go open up right now. I think you're going to see churches in the state that's not going to have services for a while because they chose not to do that. Again, I think everybody out there, for the most part, understands the significance of this, and I think we're going to see a gradual opening of the state. Again, I'm going to go back to what I said last week. It won't be a flip of the switch. I think people are going to have to work up, and consumers are going to have to get confidence enough to go out and go back in business and spend money. Again, it's about you personal responsibility, putting yourself at risk, and how you feel about that.
Hey, Governor.
Kurt?
What do you think of the idea that nursing homes should get immunity from COVID-related cases?
That's Kurt. I mean, that's a pretty broad question. What immunity from? What?
Legal from somebody
from everything.
Suing them, from somebody suing them for an outbreak, a hotspot at a nursing home.
First of all, let me answer that maybe broader than you want me to, but I think it's still the medical profession too as a whole. I think the last thing we want to start is a haven for lawsuits in this state because people were trying to protect people in a COVID-19 virus situation. So I think we're really going to have to take a good look at that, because the last thing you want is good people to be getting sued because they was trying to save people's lives in unusual circumstances. So I'm not sure what the legislatures, if they've got a bill out there, how they're going to address that. But I'm going to say the last thing I want to do is open this up for lawsuits for people trying to save people's lives.
I also have a question for the treasurer. Let's finish up with Governor Parson.
Yep. Madeline McLean with KQ2. So I am in the hot spot in St. Joseph, right where Triumph Foods is. So we opened back up today, slow rollout similar to what you said. Is that something that you recommended or were consulted on, or do you believe is the right move?
Yeah, again, I think that was up to the local levels to make those decisions, especially in Buchanan County up there at St. Joe. I mean, again, as the governor of the state of Missouri, you have to make guidance and policy that kind of fits the whole state, which is almost impossible to do when you compare small counties, small cities to big urban areas like we have. That's why, again, it's so important for the mayors, county commissioners across the state have a role to play too. They're elected officials, and they've got to figure out what do they think is the best thing to do for their communities. And if they have a, quote, hot spot, at any time during this 30 days, they can take action. And that's why we purposely left it for them to do that in case we needed to make a change in the model on that. So again, it goes back to what our blanket policy was, what we believe we should do for the state of Missouri, and then what they should do as individuals in that city or county.
Governor, can you explain why you decided to bring on the McChrystal Group to assist with Missouri's COVID-19 response?
Yeah, because about every model that you could possibly look at that we looked at early on was inaccurate. All the reporting that was done by a lot of these think tanks from all over the United States was about as poor could be. Let me just put it that way. And what we really decided is I brought my administration in, people that was involved in this, and said, look, we got to have Missouri data. I don't want to rely on East Coast. I don't want to rely on institutions from outside the state. I want to know what's happening in Missouri. So we brought them in as an advisory group to help with the Department of Health and to help to put what we call a fusion team with Director Richardson actually head that up. Dr. Williams has been engaged with that. And so we really come in and develop one of the models, I want to say one of the best models in the United States. The Vice President called and asked about it. His Rear Admiral called last week wanting to use that for the possibility of guidance across the United States for some of the things that we were doing in that. So it was very important to get the Missouri information together and put it where we could use it to make decisions, and that's what we did. So I'm thankful they come in when they did and helped put it together.
Governor, this question is on the enforcement of these guidelines. So per your guidelines on your FAQs, it says that the state is working with local health authorities on enforcing this.
Right.
But local health authorities don't really have the resources to go in and shut down a business. What does that look like to you? And do law enforcement have any part in that, whether that's giving fines, shutting places down? What does that enforcement look like?
Yeah, there's regulations on that. There's statutory requirements. Like if you take a health department, for example, if they go in there and they see violations, they can file through the courts to get it shut down if they do it. There's a process to do on that for anybody wherever you're at, if you have those violations on that.
And how are you guys looking to maybe get that information for somebody, for a business maybe who's not adhering by those social distancing guidelines? People calling in, or are there going to be?
You'd contact your local levels, like your law enforcement, like your health centers probably would be the first place I'd call to say they're not abiding by that. And then it'd be the local jurisdictions to be able to do that.
Okay, thank you.
Yep. Yep.
I do have one for Scott, but I also had another one for the governor. But Scott, could you tell us how much exactly the city of St. Louis is getting from that CARES funding?
Sure. I think off the top of my head, I want to say it was about $35 million. The breakdown by county and the city of St. Louis, obviously, since it's not within a county, is on that COVID webpage at the Treasurer's Office site that I mentioned. So you can check my accuracy there, but I think it was about $35 million.
And you said it's coming on Wednesday. Is it all coming in one chunk going straight into the bank account?
Yeah, so we basically loaded up ACH instructions today, so the city will receive that money. It should be processed by the bank tomorrow, which means it should be in their account on Wednesday, and it'll be the full amount.
Why was it population-based? As you know, like there might be a county in northern Missouri that has 5,000 residents and no cases, but they're still going to get the same kind of per capita amount. How did you decide that as an approach?
Well, first off, the General Assembly and the Supplemental Appropriations Bill, lined out that the distribution should be based on population. But I think it's also worth noting that this money can be used anytime for coronavirus-related expenses between March 1st and December 30th of this year. And so I think it's totally possible that there could be later in the year that some of these rural counties that don't have as many cases right now could have some cases, and they could have some costs associated with that. And also, I mean, one of the things that can be done, I can tell you that obviously there are going to be costs in parts of the state related to the virus that are because they've had a larger number of cases. And I think that the working group will look at hot spots, and if there's need for additional funding, advise the governor on that to let him make a decision on that moving forward. But I can tell you economically, I'm from a rural part of the state, and I can tell you economically, the economic impact has not just been in the areas where there's been a lot of cases. And so, one of the things that this money can be used for is economic stimulus programs, and counties have the authority to use it for that too. So I think that that's a reason to say that population was a good distribution model for the time being, and that we can look at other ways if it's necessary.
Will all counties get a single large payment?
Yes, every county will receive a single large payment. I guess it's possible that one of the remaining counties could potentially ask to not receive the full amount at once, in which case I'm sure we would honor that. But yeah, every county, as of today, all but the 7 that I mentioned, and actually Sullivan County, while I've been standing in here, has submitted an updated form, and there was one other county, I think, that needed to update some information on their form of those 7. So that was Clinton County. So we're down to basically 6 now, and they will all receive that money in one chunk.
And as the money goes out, does your office know specifically what it's being used for, or is that information that will come later?
So what we've instructed the counties to do, and what's included in the certification form that they were required to sign to us, was that they would account for, that we've given them the guidance. We put some additional language in the certification document, which is publicly available on that COVID webpage, that you can read the whole document that we've asked the counties to sign, that basically gives them even a little bit more guidance than that to really hone in on things that we think could potentially be issues. And, we've told them they need to keep records associated with that because we will be audited by the federal government, at which point we'll be asking for those records to justify the use of that money. And so they understand they're responsible for the use of that money. And if it's determined at a later date that the money wasn't used appropriately, we're going to be working to recover that funding because we'll have to give that back to the federal government.
Treasurer Fitzpatrick, there's been a conflict between Jackson County and Kansas City in which Jackson County is not sharing its CARES Act money with Kansas City. Has that conflict been resolved, and which party is the unreasonable one?
Well, it hasn't been resolved, and I would say that the expectation that we've set with the counties that are receiving direct or aid from the state is that we want them to be the leaders in their local communities at distributing that money where it's needed most. And all of the counties that we've distributed the money to so far have been enthusiastic about helping in that way. I spoke with the presiding commissioners of Cass County, Clay County, and Platte County, who have all understand the unique situation that Kansas City is in, being a very large city that has a lot of expenses related to the virus. And, in consultation with the governor's office, we've essentially offered those counties that we would, as the state, take responsibility for how the city spent the money if they agreed to pass that funding on relative to the percentage of the population related to Kansas City that was in that county, and had a verbal agreement with basically all three of those counties. There's been a little bit of an issue on the back end with Clay County that we're hoping to work through. Jackson County did not agree to that initially, and so far has not. They are of the opinion that the federal guidance would prevent them from administering grants to other local governments, and at least that's what was communicated to me. I can tell you that I was on a conference call last week with the governor's staff with the White House about this issue and asked for clarification to come from Treasury on that. And the last information we had is that we should probably expect some additional guidance from the United States Treasury Department on that this week. And depending on what that says, I think it will say that, yes, the counties or the local governments receiving direct aid from the federal government can administer grants. They can administer grants to other local governments. And if that's the case, then I'm sure that we'll be revisiting that topic with Jackson County and asking them to step up and do their part to support the city of Kansas City.
All right, thank you, Treasurer.
Thank you.
Any questions for Dr. Williams? I have a question for Dr. Williams.
Go ahead. Thank you. Before any questions, I do want to just thank the governor for talking about where we are in testing. And so I just finished writing this weekend a report for the Missouri State Medical Association about kind of where we've been and where we're going for them. And so if you remember when I testified before the Senate and the House back in March, I said that here in Missouri we would recommend that we do robust testing here, and other states decided not to do that, and that has served Missouri incredibly well, and the governor has been incredibly committed to that, and we have delivered. We're capacity, we're in the top tier in the United States according to the White House, and we now have the capacity to do about 60,000 tests a week, and that's growing, and different kinds of testing. And so you have to remember that. Second thing is you have to remember that really the way we look at it, we reached our peak here in Missouri among community transmission about April 6th or 7th. We've been very fortunate there. Now, again, so someone asked the question at 3:45 today, I present to the cabinet in the Fusion Cell a new website, and I hope that will be up very shortly. It is an incredibly robust, enhanced website that takes the data that we have. A lot of people have, somebody mentioned the Crystal Group, and DHSS and Todd and others. We've all worked incredibly hard to get that data that you're going to see by the end of this week in very different ways, by county, by epi curves, by percent of positive test. It's very robust to show you the information we've given the governor as he makes incredibly important decisions. And so we will have that for you. But now as we open up today, let me tell you where we are with kind of the three groups that the testing tell us about. The first thing with our robust testing, as the number of cases went down of symptomatic, and that's really what the April 6th represented. It represented community transmission, symptomatic people, 90% were coming back negative. But as we moved out of flu season, moved into that, and moved out of that, we've used that robust testing in 3 ways. And the first is that, as the governor said last week, we went into 12 counties, 9 sites that had not had as much robust testing, doing the PCR nasal swab, not antibody testing. And we did almost 3,000 tests, which is just an incredible testament to our local health departments that they were able to do that. And of those 3,000 tests, about 9 came back positive. So as we went into the 3rd ward in Mississippi County that hasn't had any cases outside of the prison down there, and we went into Saline County, and we went into Perry County and places. If you just took people, and it was not a prevalent study, it was just taking people who wanted to be tested, and as somebody pointed out earlier, most people probably went in thinking they might have something. I don't think most people just said, well, I'll just go over there and let them do it. But again, only 9 out of 3,000 were positive. And so that kind of tells us what we already kind of saw. And you'll see this when you look at the curves, that our curve for about 4 weeks has been going down. Our percent of positive tests has been going down. Our hospitalizations has been going down. All of that's been going down. So in the last weekend, and we worked all weekend, we had about 1,000 tests, if not more, come back positive. So what's that all about? And that's the second group. Because we have this robust testing capacity now, we have adopted a boxed-in strategy. We've done that in a prison, we've done that in a nursing home, and we did that at Triumph Foods. Such that 4 weeks ago, we wouldn't have known that. You wouldn't have seen those numbers this weekend because we wouldn't have tested them. But we did, and we found that, again, at this morning, about 381 are positive who are asymptomatic. And these are people who just had their temperature taken and have been asked questions and immediately test negative. And you were asking about the Capitol here, how's it different? Well, every time I come in this building, almost, they check my temperature now when there are people here, and they ask me questions. So that's a little different population than just going to Walmart, in which people have been screened, so to speak. So they're treated a little differently because they've all been screened. So that second population is the Triumph Foods. And so let's talk about that. Of the 381, we worked on it all weekend, and we've done case contacts on almost all of them. I think this morning when I talked to them, they might have had about 30. But everybody else has been contacted, and we're now with a team from Jeff City and from other counties. They're up there talking to the people that were close to them. We're still trying to determine whether the primary form of contact is at the plant or where they live. Now, when I talked to them this morning, of the 381 positive, or 391, 200 live in Buchanan County, but almost half don't live in Buchanan County. And guess where they tend to live? Kansas City, either on the Kansas side or on the Missouri side. So we're now doing case contacts on them. But remember, these are asymptomatic people. That's very different than the testing we were doing in April. So if you look at the numbers in April, when we had our peak, versus this weekend, you're comparing apples and oranges. Those are asymptomatic people, which we think are not as infectious as those who are coughing and have fevers and those other criteria. So that's the second bucket that we're looking at. And then the third one is the one we're most concerned about, and that is our long-term care facilities. When we looked at the data from this weekend, especially in St. Louis, we see a significant amount of those patients still come from long-term care facilities, where we are aggressively trying to adopt this boxed-in strategy, where we go in, and today I've been on the phone approving to go in and check all the staff, all the patients, which we did not do 3 weeks ago, to try to box those in, because we know so much morbidity and mortality, almost 50% is coming from those places. And so when you talk about testing, we're incredibly thankful that working with our hospitals and our partners and national labs and state labs, we've developed that capacity that we said from day one would get us to a better place here in Missouri, and we in fact have delivered on that. So I would ask you to keep that in mind going forward. We will continue to do our boxed-in strategy, and we will continue to do some prevalence and monitoring, some sentinel monitoring, especially of our long-term care facilities. I was on a phone call this morning. What will that look like? 1,600 long-term care facilities in the state, less than 10% have had a case, but in those ones that had, Sadly, we've lost a lot of people, unfortunately. And so we're very much focused going forward, as Scott was saying, as we look to the future, what would that look like to try to prevent that? So I want to finish with this. I practiced medicine for 30 years, and we always had a saying when I taught the medical students and residents is, don't treat the chart, treat the patient. So you can go in and look at the vital signs and say, well, they look pretty good. But if you go in the room and get ready to discharge a patient, and she says, Dr. Williams, I feel horrible. You always have to listen to that. So we're incredibly thankful for our data. We think it helps us tremendously, but we're always analyzing that data, and we're always interpreting that data, and overall, we're always looking at the patient, which for us is the state of Missouri and our 6.1 million residents. So we'd be happy to answer any questions.
Dr. Randall, so can you explain why we saw the largest single day increase today? Is that from the cases from the meat processing plant?
Yeah, so let's take, I think Friday was like 250, Saturday was like 300, Sunday was like 300, today's like 300. So if you put those all together, you're going to probably come up with about, I think, let's say 1,200, 1,100. Well, 400 of those are from Triumph. So now you're down to 800. And so that's 800 over Friday, Saturday, Sunday, and Monday. That's about 200 a day. And that's about where we were running. And we were running about 150, 140. I'll give you another piece of data. For the first time in the longest time I can ever remember, Bill Whitmar called me today at 11:30 and said, Randall, we only had 7 cases we ran today, and they were all negative. And this is a state lab that's been running 100, 150 based on screening criteria. Today we only did 7. He's never called me before 12 o'clock and given that data. So the answer to your question is that we continue to trend down, and if we'd taken out that 400 or so tests, we would be about where we are. And you're going to see the graph, I hope, by Wednesday, that'll show you over a month our trending down of positive tests, our trending down of the number of cases, and our trending down of hospitalizations.
I guess the thing that we're confused about is you keep sort of picking and choosing. You say if you take out the meat plant, then we have trending downward. Mm-hmm. If last week it was if we take out the St. Louis area, we're trending downward. But overall, those numbers are still in there. Those cases are still positive. Those people still have coronavirus.
Yeah, but think of what that represents, though. What it represents is that we think now, as opposed to 3 weeks ago, when we weren't doing asymptomatic people. What the numbers 3 weeks ago represented was symptomatic people who many times are in the community transmitting the disease. As we look at it now, we think we're in a different place. We are doing a lot more testing and seeing more cases, but a big difference between now and 3 weeks ago is 400 of those people are asymptomatic. They're not like those people we were checking that you say, we're not trending down. They're a whole different group of people, and they're in a cohort. They're in one place, as opposed to representing all of St. Louis County, which is what the numbers April 15th represent by and large. Now, if you look at it, it's really representing congregated places, nursing homes and meatpacking plants, and to some degree, you look in Kansas, they had 270 tests last week positive in one prison. Out of 296 people, 75% tested positive. That's very different than 270 people testing positive symptomatically in 10 counties. Those are two very different numbers that goes back to you have to treat the patient, not the numbers.
Is it concerning?
Yeah.
Yes. So we are finding out that Triumph Foods has told their employees to head back to work if they don't have symptoms.
Yep.
And they tested positive 7 days ago, so last Monday.
Yep.
Now, is that the correct interpretation of the CDC guidelines?
It is. I've been on the phone with them 5-6 times a day, every day for 2 weeks now. And the CDC says for asymptomatic patients, remember for symptomatic patients, it's 7 days from symptom onset and 3 days from symptom resolution. But if you don't have any symptoms, you can't use those. So if you go to the CDC website, and it's on our website, they say it's 7 days from a positive test if you have no symptoms. And if you look at the press release we put out yesterday, we said, no, in the meantime, during that 7 days, if you get symptomatic, you need to let somebody know. You need to let a provider know so we can assess you.
So I have 2 follow-up questions and clarifications for that.
Yeah.
So it also says that 3 days afterwards is supposed to limit contact. So how is going into a facility with hundreds of people limiting your contact. And then additionally, my interpretation of the CDC guidelines for asymptomatic people who test positive would also require you to have self-quarantine for 7 days, which by my own math, they wouldn't have self-quarantined because they wouldn't have known they tested positive for at least 24 hours.
Well, again, the point is that it's from the point of when the test was done, not when it comes back positive. It's when their test is positive. So for 7 days, if their test comes back and they haven't had any symptoms during that 7 days in which their tested positive, it's the date of the test that we interpret.
So, but the first sentence. Oh, sorry. Okay.
Yes, Crystal.
Director Williams, as
Yes.
the head of the state health department and as a doctor that's practiced for many years, do you recommend to the public that they wear a mask when, especially if they're in close quarters with other people?
Yeah, Crystal, I think it's situational awareness. It really is. Like I say, I certainly, as we've said before, if you're a doctor and you're examining a patient and you're 1 foot away with a stethoscope, we think that would be a recommendation. But as we reemerge, we're certainly cognizant that there are going to be plenty of circumstances where you don't need to do that. And so, I can just tell you here in the governor's office, we are incredibly purposeful about practicing social distancing, being 6 feet away. So in my own life, I will just tell you that for the last long time, I really practice incredibly intense social distancing, so I haven't been wearing a mask because I haven't been within 6 feet, if that helps. All right. Thank y'all.
Nope, I just want to I just want to clarify one thing. No, you're just doing good. It's about time to finish this up anyhow. I want to go back to the testing numbers because I know seemed like we've been talking about that a long time. However you want to look at the testing, if you want to take Buchanan County and you want to say there was 3,000 tests on that facility and they tested 381, so that's somewhere probably around 13%, I'm guessing, 13%. So if you take just those numbers, the rate would look like 13%. But if you added the other 3,000 across the state in there with that was done over the weekend that Dr. Williams said, that's 6,000. And then you would only have a percentage of between a little over 6% of the population would do that. So again, you can put the spin on the numbers. It's why I want to just say again, when you get this model out, you have to look long term at that to really know where you're at. There is going to be spikes in the numbers. We've said that almost daily because, one, you're doing more testing than we've ever done, and we're going to continue to do that. So I just want to make sure it's clear, especially for the people that's watching this briefing, that they understand that the numbers, you can pick any of them out and make a case any way you want. But the reality of it is you've got to look long term, you've got to look at a model, and you've got to really understand what's happening in the state of Missouri. So thank you all very much for being here today. Thank you.